Good morning, it's Monday morning, and I have Dr. Roman Nation here in the studio. And we're going to talk about some topical health issues that are in the news nowadays. Doc, thanks so much for coming back on the show.
Sure.
You know, it's been a few days, and, Robin Williams, it has passed.
Yep.
And there's wild speculation over how he had done this and that he had perhaps suffered from depression.
Yeah.
How does, for a guy like me, and maybe for a lot of our viewers, someone who's that affluent and that famous and that popular and that beloved, how do you become depressed like that when you apparently maybe have the world as your oyster?
Well, there's a couple of different discussions about that. One of them is the old adage that money can't buy happiness.
Yeah.
And then the other one that was just on the news this morning, they were talking about. There's a lot of people in the creative arts that are like that, and that creativity comes from an area of your brain that generates a lot of that happiness, and that's how they go. That's how they,
So that makes them happy.
That's how they entertain. They export all of that creativity, and it shows up in the media. Well, on the flip side of that same creativity part is the negative side of things. And so just as all those positive images and stuff come out that makes all that money and makes them celebrities and stuff like that, there's actually a little demon and a lot of the times like tormenting them on the inside.
Well,
and you don't ever see that part because that doesn't make news, but we do see it here and there, like with Robert Downey Jr. and his alcoholism. Robin Williams was very open about his drug addiction issues that he had. And his alcoholism problems, and even Chevy Chase admitted that he and Robin Williams both had depression issues. So there's a lot of those kind of psychiatric diagnoses in the creative realm.
It's almost cliche now to have the tortured artist.
Yes.
Like Michael Jackson.
Yep.
Who is beloved by perhaps millions of people, but very alone in the world. Is there something that happens to people psychologically when they become like super famous?
Yeah, chemically inside your brain, and there's a thing that happens. A lot of things in the media industry are based on novelty, meaning that it has to be new. It has to be new and shiny and different for it to create a chemical reaction in your brain.
Not like this hackneyed old show.
Well, we try and stay current, but we don't do anything on this show that's flashy.
No.
We don't try and come out and say well, we've got the greatest things that that's just been invented. The stuff that you see on a lot of these shows, they act like it's brand new and has never been heard of before. It's been around for a long time.
It's all been done before, I'm sure.
Yeah, especially when you look at the fashion industry or even up to a large extent the medical industry, unless you're talking about new technology that's being built, and there's a lot of stuff going on there. But when you talk about medicines and those kinds of things, the pipelines to build new medicines is really, really long. And so they just end up recycling a lot of old things.
And if you also look at the entertainment industry, singing, dancing, I mean...
Right, they retell the story,
Yeah.
And it's an underdog story or a drama story.
There are formula plots
Right.
that are guaranteed to entertain and make box office.
Right, exactly, yeah. So, we see that kind of stuff all the time. But
So do you think that maybe artists feel they maybe have a shallow existence and that maybe it has been done before and they're not doing anything that meaningful?
They even make it's not the not meaningful part of it. What happens in the entertainment industry is that people get their ego is externalized into their audience, meaning that if they don't have some sort of positive feedback coming back from the audience, then it turns to a negative. And so they even made fun of that on like the Big Bang Theory. Where
as seen on Fox.
That if your ego is externalized, and once you do that, once you take it outside yourself, you no longer have control of it. And you see that all over the entertainment industry. That's why they turn to drugs and alcohol and those kinds of things. I mean, you look at even Justin Bieber. He got really famous and was this Christian model. Miley Cyrus is another one.
But you look at those type like little young rock stars, and that's a function of age. You think, well, maybe they're just immature and they can't handle the thing. But then you look at Robin Williams, who's 63 or 64-year-old man. And it's like, geez, do you think he'd know a little better?
Yeah. Well, and I think he tried. That's why he was checking back into the rehab center. I think it was last month or something. But sometimes those therapies just aren't enough. They can't get there.
Well, we've got to run off to the local weather. But on the other side of that, let's talk about maybe some things that can give people a better positive outlook what you should look out for, what the warning signs of depression are, and how you can help someone who you may love or know who may become depressed. And on that happy note, we'll be right back after your local weather, brought to you by the West Pittman Law Firm. westpittmanlawfirm.com. Welcome back to the show. I'm speaking with Dr. Roman Nation, and we're talking about depression in the news and perhaps maybe even in someone you love's life.
Yep.
What are the warning signs that someone's depressed? I mean, beside maybe them being in a bad mood.
Well, as simple as it may sound, there's a couple of questionnaires that we use in the clinic a lot of times, or actually every time a patient comes in, and the two most sensitive questions to determine if somebody could be depressed, one of them is, over the last 2 weeks, have you felt tired, hopeless, or helpless? And the other one is, in the last 2 weeks, have you lost interest in doing the things that you used to like to do? And those two are pretty sensitive questions for when people are starting to get depressed. And then there's another set of 9 questions that go beyond that if either one of those two questions is a yes. And so we ask patients about that. And we treat a lot of depression in primary care. And most of the times they're decently successful with it. It just depends on how amenable patients are to therapy. And you have to be regular with your medications, and you have to follow along with therapy and that kind of stuff.
But everybody has down days. I mean,
absolutely.
I mean, you're in good mood, bad mood. You're happy, you're sad. It's part of the human condition.
Yeah.
I guess it's when those down days become the norm.
When they're and that's the unfortunate part about a lot of things with depression is people will slowly get depressed a lot of times, and they won't realize what it's like to feel normal because normal has been so far back. That they don't remember what it's like. But socially, if you're talking about family members or things that would be warning signs, one of them is mood irritability, and there's a lot of confusion sometimes for women, during their cycle, that they'll have mood swings up and down, and if it's a short-term thing, meaning it's just for a few days, then it's really a more hormonal change, and hormone changes mimic a lot of symptoms that are in depression anyway. It's when it's after that short-term period that it becomes a long-term thing where they're just moody all the time, that we encourage them to get help.
Is happy and sad a chemical thing in your body? Is that a biochemical?
To a large extent, yeah. There's a brain chemistry that's related to happiness, but there's also a lot of what we call the reticular activating system, or basically how we filter information from the outside world, how we interpret it, and how we absorb it. Because there's a lot of tragic things that go on in this world, and you can choose to absorb those things, or you can choose to set those aside and realize that you can't control a lot of those things. There's a lot of religious focus on that in terms of how things could be better, or you could be better, but you have to look for the brighter side, or look to God for the answer, those kinds of things.
But there's always people have to have hope. I think once you become hopeless is when things
and that's why
bad.
that question is there, is if you're hopeless or helpless. The other thing that's a really key factor is being socially withdrawn. So you'll have folks that just kind of back away, and they used to be more outgoing, and then they kind of back off and don't do a whole lot. One of the end stages before people become suicidal is that what they call severe anhedonia, meaning that
severe what?
Anhedonia.
Anhedonia.
Yeah. So you know what hedonism is, right?
Sure.
Okay. So hedonism, anhedonia, is the absence of hedonism. Means it's the absence of self-pleasure. So meaning that if you had somebody who used to have a hobby, whether it's hunting or working on cars or gardening. I mean, you name it. People have some sort of self-indulging activity that they usually like to do. When they start withdrawing from that and they no longer do it, is when you really start to pay attention. And then there's end stages of suicidal ideation and things like that, where people will start talking about what they want to have done when they die, or if they have prized possessions, and they start talking to people about giving those away when we don't have.
So they're actually making plans.
Right.
When I was in the Air Force, and you were also an Air Force officer at one point, a doc, we had a concept called the wingman concept.
Yep.
Where you're supposed to look after your buddy.
Yeah.
And if he starts acting weird or something like that, you've got to say something, tell someone or whatever. Does that work in the civilian world as well? It
can. The problem we always had in the military was the wingman concept was if somebody reported you or was concerned, and then you got sent over to the mental health clinic. They renamed that several times, trying to make it sound lighter and fluffier. But there was always this gigantic stigma that, oh, you're crazy, so you're going to get kicked out of the military.
Yeah.
Well, and unfortunately, there's still a lot of that stigma there, which is why there's still a
to Dr. Nation, we're so out of time. But thank you so much for cheering us up on a Monday morning. And, but stay happy and look after your loved ones, and we'll be right back.
Hi, this is David Lovett, and this is your Mad Hatter Minute. Today we're going to be talking about brake pads and brake systems on your car. The first question that I have to ask you is, how do you know when you need brakes? And typically there's only two ways that you know you're going to need brakes. One, if you're driving and you apply your brakes and you get a vibration, most typically in the steering wheel. The steering wheel start vibrating, you know you got a problem. If you feel it in your seat, feel vibration back in your seat, you know you got a problem. Second way to know that you might have a brake problem is noise. You hear a squealing noise when you're pressing your brakes. What that is that the hardened metal on the backing of the brake pad is actually making contact to the rotor. And it's your sign, it's your signal to say, hey, there's something wrong, time to get it into a shop. Now, in a standard brake job, there are actually 4 different components that you typically look at. Many other components on a brake system, but on a standard brake job, you typically look at your brake hoses, your brake calipers, your brake pads, and your brake rotors. All right, the hoses provide the fluid to the caliper. The caliper closes the pads back onto the rotor. The pad has friction material that makes contact to the rotor, and that's what makes your vehicle stop. Now, what I have here is your standard brake pad. Your brake pad has a friction material on the front, and it has backing material on the back. It also has this little tab right here that when you get low with the friction material, it's going to make a squealing noise. If you let this friction material get down into the squealer tab, it's going to squeal like a pig, and it's going to start damaging your rotor. Get your car fixed immediately. If it goes too deep into that rotor, you're buying new rotors. And soon, a $100 brake job turns into $200, $300 real fast. Don't play around with your brakes. This has been David Lovett, and this has been your Mad Hatter Minute.
Welcome back to the show. I'm here with Dr. Aaron Shores, and we're talking about platelet-rich plasma. What exactly is that? I know we talked about it a little bit last week.
Right.
Could you just a quick redefinition of what that
Sure.
is?
Platelet-rich plasma is a way to treat certain different types of painful disorders or tendinitis injuries or tendon injuries, sometimes some joint injuries, where basically we draw out a patient's own blood. We put it into a centrifuge, spin it down, and then we draw out a portion of the blood called the plasma, which has platelets in it. And platelets are generally thought of as the cells that make you stop bleeding when you cut yourself, but they also have a lot of healing factors in them, and we can concentrate those healing factors sometimes up to 10-fold or greater. And we inject those healing factors directly into or around a tendon or a joint or an injured area, and it can promote healing in an all-natural and a homeopathic way. And the data is showing that there is some success there, and it's an alternative to surgery. A lot of patients are trying to do what they can to prevent surgery. So a lot of some famous athletes on television have used it on a regular basis for their various tennis elbows or golfer's elbows or Achilles tendon issues or plantar fasciitis. So it's what we call a biologic treatment. And I think it's going to have a real place in the future.
But it's really no substitute for surgery sometimes. And if you have a rip or a tear, I mean, I guess it really depends on the severity of it.
Well, I think everybody is a little bit different, and that would be something you'd want to discuss with your physician. There are some data to suggest that platelet-rich plasma with certain minor tears can be a treatment and keep someone away from surgery. But certainly serious tears or large tears in certain parts of the body certainly are going to require surgery. So it's not to say that surgery is never going to be needed because platelet-rich plasma is that effective. But it certainly is effective when steroids fail for some patients, because in the past, if you did physical therapy and you had a couple of cortisone injections, there wasn't always an alternative. There were some other types of injections that could be done called prolotherapy and things, which still have a place, but platelet-rich plasma and some of the other biologic treatments, stem cell treatments, I think really are going to be a way of the future and be around for a while.
I would imagine that those type of therapies would be used in conjunction with some sort of physical therapy too. Is that not a
usually after the platelet-rich plasma, there usually needs to be a period of rest or immobilization to give the healing factors a time to work. So usually the procedure needs to be, not usually, sometimes the procedure needs to be repeated at some point in the future, maybe 6 to 8 weeks or so after.
To give it a chance to mend and
heal.
To
give it a chance to mend to heal. And then at that point, if the patient is starting to show that they're a responder, then doing physical therapy or some other rehabilitative techniques to help not only recover but prevent future injury certainly has a role, absolutely.
So it makes it heal faster, is that what I'm hearing? Or better and faster? Or?
Well, that data is still developing. The research is ongoing there. But in patients, for example, who have tennis elbow, is a very common one.
What exactly is tennis elbow?
Tennis elbow, there's a tendon in the elbow that gets inflamed, and you don't always have to be a tennis player to get it. But it's commonly what we call a repetitive use injury. Typically, and it can become very difficult to treat, because physical therapy and steroids don't always work for it. So in the past, the other alternative may be to either live with it, brace it, or have surgery. But platelet-rich plasma, for example, for tennis elbow, has a real place. Now, whether it helps patients heal faster, I think that's a little bit patient dependent, but it certainly can help in patients who fail steroid therapy. It certainly does seem to have a role in helping improve symptoms and return some patients back to where they'd like to be.
And I guess that's where the whole art of medicine comes in.
Correct.
See what actually works on which person sometimes. I mean, one size really doesn't fit all, does it?
Correct. Yeah, unfortunately it's not predictable all the time because not everybody responds to every treatment. So you're right, it is a little bit of trial and error in the art of medicine, but it certainly can be a benefit in some patients who are trying to have failed other treatments and are trying to prevent surgery. Sometimes it can help.
Is it something I should ask my doctor about? If I have tennis elbow, I said, how about platelet-rich therapy?
Absolutely.
Yeah.
Not all doctors do it. So some physicians, since it's a newer technique or newer technology, are learning about it as well. But we in Panama City in the Northwest Florida area, we're one of the few practices in the area that do provide the service. So certainly asking a physician would be a good place to start.
Dr. Aaron Shores from Spine and Neuro Pain Specialist, thanks so much for that, for your wisdom, and thanks for sharing that with our audience here.
Thank you.
We'll be right back after these messages. Welcome back to the show. We've got Thomas Winterman, who is the author of The Thrive Life, the life-changing book, The Thrive Life. And if you don't have it, get it on Amazon. And he's going to give us our Thrive Thought for the week. Welcome back to the show, Thomas.
Thank you. Glad to be back.
Yeah. Now, The Thrive Life, as we had mentioned in previous interviews, was a work pretty much of your own creation. And it really documents your journey from not thriving to the thriving person you are now.
That's right.
And all those lessons along the way. Now, what tip can you give us this week? And I know many of the tips in there are about incrementalism, taking little baby steps. Now, what little baby step can we take this week?
When it comes to goal setting, focus on things that you are 100% in control of. Setting a goal of having a better marriage is a good goal, but it's dependent on another person. So a better goal to set would be to be a better spouse, because you could do everything you can to have a better marriage, and you might not succeed in your goal and feel like you failed when you've actually done your part.
Well, that's true, because you can only control what you can control.
That's right.
And you can control yourself. So make your goals realistic and make them attainable.
And make them personal. Make it something that you are completely 100% in control of, so that way there's no other variables that could factor in there.
Yeah, and I guess a lot of that has to do with maybe changing your thought habits too. I mean, we do have habits.
That's
Just like you get up in the morning, you brush your teeth or whatever. You have habits in the way you respond to people and situations. And the person you respond to the most in your life is probably your spouse.
Probably, yep.
So you got to think of new ways of responding to that person.
That's right.
So, and how do you incorporate those little changes? Do you do that on a weekly basis? Do you say, well, I'm going to change a little something about myself? Are you done?
Oh,
are you all done? Are you perfect now?
There is no such thing as done, and that's one of the great but also incredibly frustrating things about setting goals, is that there is no such thing as arriving. As soon as you make it to a goal, you've got to set a new one or you start moving backwards. If you're not moving forwards, you're moving backwards. So, yeah, absolutely. Every single day, it takes setting new small goals for yourself.
So you can backslide.
Oh, easily.
I mean, I know in previous talks we've had, we talk about the benefits of moving and exercise.
Yes.
There's nothing easier in the world to do than miss a workout. I mean, so if you can miss a workout, you might miss out on one of these new habits you're trying to create for yourself.
That's right.
Even after you started doing it. So just, I guess, doing an occasional self-check is useful as well.
That's right. Being mindful.
Being mindful, which is another Thrive thought. So the Thrive thought for this week is?
Set goals that you can control.
And we'll leave it at that. Thanks a lot for watching, and set goals that you can control, because that's your Thrive thought for the week. We'll see you next time.